Can you stay on Mounjaro long term for type 2 diabetes? It's a question that's becoming more and more common as tirzepatide becomes a bigger part of managing this condition in the UK, and it matters because type 2 diabetes isn't a short-term condition. It's chronic and progressive, which means treatment decisions, including how long to stay on a medication, need to be thought through carefully. So let's look at what the evidence actually says. Mounjaro is the brand name for tirzepatide, a prescription medicine licensed in the UK specifically for type 2 diabetes, not type 1, and not for use during pregnancy. It works by mimicking two naturally occurring hormones in the body, GIP and GLP-1, known as incretin hormones, which play a role in regulating blood sugar after eating. What makes Mounjaro different from some other diabetes medications is that it targets both of these hormones at the same time. GLP-1 helps stimulate insulin when blood glucose rises, suppresses glucagon, slows digestion, and reduces appetite. GIP also supports insulin secretion, and research suggests it may influence fat metabolism and energy use, though the human evidence for those effects is still developing. Together, these actions help improve blood sugar control and support weight management. It's a prescription-only injectable medicine, and your healthcare team will advise on how it's taken. Now back to the main question. Can you take it long term? Current evidence suggests yes, Mounjaro can be used for extended periods. Clinical trials have shown it to be effective for up to 2 years. And importantly, research suggests that when people stop taking it, blood sugar control often worsens and weight can return. That tells us something significant. For many people, this is a medication that needs to be continued to maintain its benefits, much like other treatments for chronic conditions, but long-term doesn't mean without review. Continuation isn't automatic. It requires regular clinical assessment to make sure the medication is still working, still appropriate, and still safe for you specifically. On the NHS, NICE guidance sets out clear criteria for continuing Mounjaro. At the 6-month mark, your healthcare team will assess whether there's been a meaningful improvement in your HbA1c, that's the measure of longer-term blood sugar control, alongside weight changes. If those thresholds aren't met, NHS funding may not continue. Your doctor or diabetes team will be able to explain exactly what those criteria mean for your situation. In terms of safety monitoring, there are several things your healthcare team will keep an eye on over time, including gastrointestinal side effects like nausea or digestive discomfort, which are common especially early on, as well as signs of pancreatitis, gallbladder disease, and kidney function. These aren't reasons to avoid the medication, but they are reasons why regular reviews matter. If you're currently taking Mounjaro or considering it, here are some things worth discussing with your doctor or diabetes specialist. Ask about your 6-month review and what will be assessed. Talk about how your HbA1c and weight are being tracked. Ask what would need to change for your prescription to be reviewed or stopped. And if you experience any new or worsening symptoms, particularly persistent abdominal pain, contact your healthcare professional promptly, as that can sometimes need attention sooner rather than later. To recap, Mounjaro can be used long-term for type 2 diabetes, but long-term comes with important conditions. Evidence supports extended use, and stopping is often associated with a return of symptoms. NHS continuation depends on meeting specific clinical criteria at review, and ongoing monitoring is an essential part of staying on it safely. As always, everything in this video is general information only. For advice that's specific to your health, your circumstances, and your medication, please speak to your GP or diabetes team, and never start or stop a medicine without their guidance. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please like this video and subscribe to the Bolt Pharmacy channel for more evidence-based health content.